Yeah, I'm Dr. Yeow. I'm an ENT surgeon here in KPJ Johor Specialist Hospital. I did my medical studies in University Science Malaysia in Kubang Kereng, Kelantan. And then subsequently, I was a houseman in University Malaya. After that, I did my medical officer posting in Cebu, Sarawak, where I did my surgical training as well as ENT training. After that, then I did my master's in back in USM again, University Science Malaysia, for 4 years, finishing with a master's in ear, nose, and throat, or otorhinolaryngology, and head and neck surgery. The ENT department in Johor Specialist Hospital, there's 3 of us, ENT surgeons, myself, Dr. Azida and Dr. Shankar. We each have our strengths and areas of interest and expertise. We work very well together in the sense that utilize each other's strengths. Also, our equipment as well as our services is very complete. We have an audiology unit, we have a vestibular testing unit, and in the operation theatre, we have a navigation system, we have a poblator system, we have a state-of-the-art microscope. So that allows us to do very extensive and advanced work such as skull-base surgery, cochlear implant, head and neck cancer surgeries, and even very minimally invasive work for children. My areas of interest are head and neck surgery, obstructive sleep apnea, as well as biologics in nasal polyps. In terms of leadership, my roles as Medical Director of Johor Specialist Hospital, as well as the Chairman of the Clinical Research and Ethics Committee of KPJ. And I feel these roles are very humbling. It's a great honor to serve in these roles. What I can do is to really serve people to be their best. This academic healthcare system progresses. That's where I feel leaders really play an important role. When leaders have the same vision and is able to negotiate or maneuver this journey of change very carefully and very compassionately also. Change takes time, but it really involves us enlisting or identifying the early adopters who can challenge others, set an example for others to follow. And really the game is to convert cynics to champions eventually, and I believe we can do it. KPJ Academic Health System, a very complete, comprehensive, very progressive way of doing healthcare, because we are combining excellence in clinical care with also research and innovation, as well as teaching, education for the future generations. And I think it's really important that we think about care in a very holistic way. Hippocrates once said, we cure rarely, but we treat often, but we comfort always. So in clinical care, it's really important to look at the patient as a whole. Here in Johor Specialist Hospital, we want always to put the patient first. Patient-centered care is not about us knowing what's best for the patient, but to bring the patient on board in the treatment, where they are like partners. We call this a therapeutic alliance. Together with the patient, help them understand their condition, work out their plan with them, advise them on their options, and then let them come to their own decisions and be empowered or take charge of their own care and their care journey. I think our role as doctors is not just physician, but as a healer as well as a friend. We walk with the patient in their journey of healing. Everybody wants to be seen and feel that they are heard, and that's what we are here for. Not just to deliver treatments, not just to give medications and do surgery, and to help them feel that they have someone they can trust to walk with them on their journey of care.